with the amount I was doing. We were willing to give anything a shot, and so I enrolled in this place, and it just did wonders.
Mostly the craving was just gone. That was the number one thing that I noticed was I don't need to feed myself that crap anymore.
I don't miss it on a physical level. I may miss it on a social level, but I don't miss it on a physical level at all. And it's hard to believe. That's all I can say.
It seemed like it hit every, point that you needed to get over this. And, I found myself really wanting to get off drugs for the first time.
It changed my life for the better. I'm a much better person than I ever have been before. I'm absolutely clean and sober.
Most recently, I've pretty exclusively done crack. For me, it's always been a secret. I know a lot of people are like social drug users and they like revel in it or whatever. Well, I don't. It's like just a closet coping mechanism. Like I never do it in front of people. And nobody that you'd ask would probably know anything about it. It made me able to function, to like get up and take care of business and be normal and not just so emotional. I felt, like I would imagine a normal person feels in their regular life. I would like to feel just normal, like not like I'm needing to escape anything or run away.
This treatment works for any addictive process because the addictive processes are driven by neurotransmitter depletion. What that means is that whenever you engage in an addictive behavior, it fires certain neurotransmitters. It uses them up in great big bursts. And that includes sex addiction, gambling, bulimia, overeating, as well as your more conventional drug and alcohol addictions. What the center provides in terms of nutritional support starts with the amino acid bags, which also have vitamins and minerals in them. Because those are the cofactors that the brain needs to put the amino acids to work. Then we give people the oral amino acids and L-tryptophan to continue to address the depletion in brain chemistry. We do a lot of teaching about blood sugar and blood sugar regulation, healthy meals, healthy cooking. We don't teach cooking classes, but we help people identify if that's something they need to build into their own life.
Conditions that have happened when they've been intoxicated that they had no intention of involving themselves in, problems in relationships, job-related struggles, medical problems, the list goes on and on. What's difficult about the treatment of addictions is that the recidivism rates are very high. The reason they're high is because people are using drugs that are extremely reinforcing of behavior. They're extremely habit-forming. The drug, whether it's alcohol or cocaine, what have you, says to the brain, do that again. You used, I felt a certain way, use again so I can feel a certain way. Difficult, very hard work that a person who has an addiction must go through to be able to get to a place where they can maintain sobriety for any period of time, and how they were excited about being sober in a way that they had not been for some period of time prior to that. That was very powerful.
It's day 4. I'm feeling better than when I first walked in here. I'm a lot better than yesterday. I was not good when I first came in. I just totally overwhelmed by emotions, crying the whole way here. I don't know, I just couldn't deal, and now I feel stronger. I feel like it's great that they're trying everything they know of, like every trick in the bag to help you.
It is so rewarding to see somebody who came in struggling so horribly to begin with, be able to go through some period of treatment, dedicated, trying, struggling, and to be able to emerge feeling so good. That is a moving experience.
My family didn't know where I was at. They just knew I was living out and around somewhere. This is just one of the places that I stayed. It's another campsite. And as you can see, there's some people who currently reside here, living out of a backpack, sleeping on cardboard or whatever I could find. It was very cold at the time. Some ambulance company came and retrieved me. I don't know who called them, and I don't know how they got me out of here. It's kind of steep, but I woke up in the hospital. I went to my family's house one evening and they told me of a program, and I said, sure, I'll do it. Anything's better than living outside. I thought it was just like all the other programs that I'd been to. So I said, sure, at least I'll be indoors for a while. And as soon as they stuck me, or as soon as they gave me the IV, I could actually taste it. And after about the third day, I actually felt good about myself, and my thinking process had started all over again. I was actually thinking, and it wasn't just about going out and shoveling rock for a temporary labor pool or getting drunk. It was like how and what I could do to advance my life so that I wouldn't be back out here underneath a bridge. By the fifth day, I went for an interview, going from living under here to wearing a suit in an interview as an auditor for a 5-star hotel. And before I completed the 10th IV, I was hired as an auditor position. I would tell somebody who has a drinking problem or an addiction of some sort, for myself, you can talk my ear off and tell me what I should do and what I shouldn't do, places to avoid, the triggers. But there's a difference when they actually change your chemistry. They completely changed my thinking pattern around. Life's been going good. Instead of taking backward steps, I've taken a few lateral steps, but most of the steps that I've taken have been forward with my life. It's nice to be able to think clearly again.
Yeah, I've loved bikes my whole life. I've worked on them and rode them and bought a brand new Harley in 2002. It was great until I started getting high. Then I stopped riding it, stopped going on rides with my friends that are sober. It started out as fun, just to have fun and hang out with the group, and that's all we did, but it led to much worse things, and then one step led to another, and next thing you know,